Good morning, good afternoon, good evening. Welcome to OET Medical Online with me, your teacher, or one of your teachers, Trevor Gordon. Today's video continues with our theme of videos based on the grammar issues you will encounter when writing a letter or your letter in the exam. Today we're going to look at relative clauses in writing. When writing for the exam, you need to display a variety of grammar types. So today we're going to look at relative clauses. We use relative clauses to describe a subject or topic without having to resort to using a new sentence. The topic and the description are placed together grammatically. We use words such as who, where, which, when, and that. We're going to look at some uses for relative clauses within the letter. Okay, we can also use clauses, relative clauses, to combine information into longer sentences. And we can use it also, subsequently, to add more information, which obviously makes the sentence longer. We can do this by using the words who, where, which, that, when. There are a few more, but for the letter, generally, this series of words is all you will need. So instead of creating two or more sentences, or two or three sentences, we can use this grammar structure to condense our sentences into one sentence. So again, this will show the examiner your grammar skills and your writing skills. It will show the examiner that you know how to do this. And again, one of the criteria for the letter is for you to demonstrate different kinds of grammar. That's what they're looking for. So this is relative clauses are one of several ways that you can introduce different kinds of grammar into the letter. Okay, so let's begin with an example. Here we have two sentences. First one in blue. We have admitted a new patient. He or she arrived earlier in the day. Now, here we're going to use a relative clause. We're going to use relative clause who, because who talks about people. A new patient is a person. He or she is also a person. So the sentences here tell you what you're talking about. So what you're talking about determines which relative clause you use, or which relative clause word, should I say. Now, because we can use who, we change our sentence to, we have admitted a new patient who arrived earlier in the day. So, who arrived earlier in the day is the relative clause. And remember, why is it a clause? Because a clause has a subject and a verb. Remember, subject who, because the subject is the person, the new patient. Arrived is the verb, so it has a subject and a verb. If there's no verb, it's not a clause. Yes, very important. So if you write a sentence and it doesn't have a verb in, it is not a clause. A clause must have a subject and a verb. Okay, so the clause word who is used to talk about a person. And we can also add to the sentence grammatically if we choose to, because this structure allows us to. So we have admitted a new patient who arrived earlier in the day, and, or, who, we could even say who again, but we don't need to. That, or there are different there are different ways that we can continue. Okay, we're going to look at some examples of ways that you can use these clauses in the introduction or in the first paragraph of your letter. After we've used the clause, we can actually add information to the clause. So I've got different colours here that signify different things that you may use in your introduction or in your first paragraph. How the patient arrived, by car, by taxi, by ambulance, if it's included in the information. If it's not, you can't use it. Who the patient arrived with: mother, father, sister, brother. If it's elderly people like a grandfather or grandmother, could be with their children or with their grandchildren. So there's lots of scope. Again, if that information is not there, you don't need to use it. The condition of the patient. Well, of course, every patient arrives with something. Here we can use severe something, an emergency something, acute. These are adjectives, but obviously we'll be talking about certain illnesses or conditions. What happened to the person? Did they have an accident, a fall? Were they attacked? Did they break a limb or a bone? A limb means arms or legs. Or did they break other bones? The complaint, the illness, which is what will be your fundamental thing to write about. Did heart attack, angina, nausea, vomiting, hundreds of things it could be. So these are just a few examples. And the last in green allows you to put a description of the patient before you use the clause. So a 33-year-old male, a 70-year-old female, or a high school student, a university student, a businessman, lots of different choices. But this has to go before the clause, which you can see here. So we have one clause that we're using just to keep it simple. We're going to use the same clause from the other page, who arrived earlier in the day. So we can begin with the patient who arrived earlier in the day by ambulance, and then we continue, is suffering from, or is whatever the illness is. The patient who arrived early in the day with his father, with his mother, with his children, whatever. The patient who arrived earlier in the day with a severe pain in his or her chest. The patient who arrived earlier in the day after a car accident. The patient who arrived earlier in the day after suffering a heart attack. So there's different ways that you can add to the clause. Because the reason we do the clause is usually so we can add something to it. We're describing something about the patient. In these, we're just saying that the patient arrived earlier in the day. So we know which patient we're talking about. So the clause is describing which patient we're talking about. And the last one, if we're going to put the age or description of the patient, we have to do that before. So as you can see, the sentence says the patient, a 33-year-old male, or it could be a 16-year-old female, an 80-year-old female, a 33-year-old office worker. There's lots of choice, but that will be in your information. That will be in the notes that you're given for the exam. So you put in whatever's there, but it must go before the clause. So we put this, who arrived earlier in the day, and then we continue. So on our next page, we can look at some examples, or an example of how we can use this grammar structure in the introduction to the letter. And then we're going to look at how we can use it in the first paragraph, which usually is the current situation related to the patient. So here we can see we're introducing our letter. I would like to refer Mr. Jones, a 33-year-old male, who was admitted to emergency yesterday by ambulance after suffering a heart attack. Then we finish that sentence with the for your further investigation or for an examination or whatever you want the person to do. Yes, you're referring him just for further treatment. What you're going to request will be at the bottom of the letter, so you're going to repeat it. Here you don't need to say fully what you need. You could say for further investigation. That's all you need in the introduction. You're referring the patient to this other medical professional for further investigation. You'll say at the end of the letter what you want them to do exactly. So you don't need to say it here because you're going to stress it more at the end of the letter. So we have all the things we need here. The patient name, the referral, and what condition or what the issue is. How they arrived is not so important because that's not really going to help them do their job, but they need the patient information. They need to know what you're asking for. You're asking to refer the patient to that person. What's wrong with the patient? Heart attack. So they have all the things they need to move forward in reading the letter. But grammatically, as you can see, all of this has been placed into one sentence because the clause here, the relative clause here, allows us to add information, and it's a very good tool to use in writing and to display or demonstrate to the examiner your grammar skills. Okay, let's look at the first paragraph of the body. We can use the same structure if we want to introduce the main paragraph of the letter, which details the events, examination details, etc. So I've given you 3 examples. Patient name, he or she, so we could say Mr. Jones, who, or we already have the patient name, so we could begin by saying she. No, we can't actually, sorry, because we can't say she who was accompanied. I just realised that. Mrs. Jones, who was accompanied by her husband, was complaining of chest pains and was admitted to emergency for examination. Mr. Smith, who was complaining of chest pains, was admitted to the emergency accompanied by her husband. Miss Jones, who was admitted to the emergency after complaining of chest pains, was accompanied by her boyfriend. Maybe she's not married, but she has a boyfriend. So you don't need to say after. So you can say Miss Jones, who was admitted to emergency complaining of chest pains, or after complaining of chest pains. Both are okay. Now, a final note on this, for this part of the video. When practicing, you don't have to write the complete letter each time. Practice writing clauses. Practice writing a sentence like this or sentences like this to introduce the first part of the patient's information. You don't have to write a whole letter every time. One thing I've noticed with my students personally, even though I do mention it regularly, is that when they write, they always want to write the whole letter. Yes, you can write the whole letter, but if you're working on a specific thing, just write that thing. Because you can spend more time practicing it than you would writing a whole letter. If you know how to write other aspects of the letter, don't spend time doing that if you know it's already correct. Practice the things that you're not so good at and the things you need to improve, and repeat them things. The reason for that also is that time, you don't have that much time to write this letter. With all the things that you have to do, you don't have that much time. You don't want to be sitting there wondering how to write a relative clause. By the time you come to the exam, you should know how to do it. And that comes from practice. So please practice these things. Doesn't matter if you write 10 or 20. By the time you've finished practicing, you'll know what to do. So you don't have to think about that so much. And again, obviously, if your grammar level is low, you need to practice these things repeatedly. If your grammar level is higher, then you can practice less and also focus on other things. But practice is the key here, because English isn't your first language. So these are things that you need to repeat again and again until you feel confident enough to write those sentences without any problems. Okay, other clause words. Which, when, that, where, whose. These are the descriptions. Which is for choices or specifics. When is used for time. That is used for things, objects. Where is used for location. Whose is used for possession. Some of the grammar here is interchangeable. So you can use different word types depending on the sentence. So I'm just giving you an example here. That is the hospital which I work in. That is the hospital where I work. That is the hospital that I work in. All three of those sentences have exactly the same meaning, but the grammar is slightly different. So you can practice these things as well. So you know when you're writing the sentences, the grammar is also correct. And of course, if you need any help or assistance, you can always send us an email, or you can write comments in the video, and I will send some information or write some information in the video to answer your question, hopefully. Okay, some examples of which and when. So again, which means choice or a specific thing. The hospital which she was transferred to. It means a specific hospital. The medicine which he has been taking for several years. We're talking about a specific medicine. Procedures which were followed during his or her treatment. Specific procedures. Treatment which he or she had following his or her accident. Means the specific treatment or the choice of treatment. Specific or choice. Which. When. Obviously about time. The time when she was admitted to the hospital. The treatment he or she was having when he or she was diagnosed with an ulcer. So this time corresponds with this time. The treatment they were having at the same time that they were diagnosed. So again, this is time. When. The drug she took when she had diabetes. So she took these drugs when she had diabetes. But that's not a clause. This is a clause. So you can say the same things, but you change it into a clause. The diagnosis he or she was given when he or she was examined. The time they were examined and the diagnosis they were given at that time. That and where. Remember, that can also be used for who or which. I don't use it for who because who is better to describe people. That can be used for objects. So I don't use it in that case. I would rather use, if it's people, I always use who, if possible. Sometimes grammatically you cannot do that, but that's not for this video. Okay, so the operation that he or she had to remove his gallbladder. The pain that he felt after his operation. sensations in her legs that affected her ability to walk, the tingling that she felt in her back after her operation. So again, these are examples of how you can use that. You can also use which. So we could say the tingling which she felt in her back, or the sensations in her legs which affected. So that and which can be interchangeable, but not always. Where? That is the hospital where she was treated. The part of his leg where the pain is located. The part of his stomach where he was given the injections. Last one here is whose. Whose is used to talk about possession. We have 3 sentences here. Mr. Jennings, whose son is having treatment for bowel issues. Now, Mr. Jennings' son could be very young, 6, 7 years old. So in this situation, the doctor, the medical staff will talk to the parents, not the child, because the child might be too young to answer the questions. So the parents accompany the child, because obviously the child could be too young to go alone. So this is just telling you the son of Mr. Jennings. Mr. Jennings, whose son? The son of Mr. Jennings. Next sentence. Please check the patient whose vital signs need observation. The vital signs belong to the patient. The patient whose treatment begins next week. There could be a specific patient who begins their treatment next week, but we've combined it into a clause. Whose treatment begins next week is talking about a specific patient or a patient. So whose treatment? The treatment belongs to the patient. Now here you can see we've joined a couple of clauses together to get a longer sentence. We can join clauses together to extend sentences and combine information. The patient whose treatment begins next week is being treated for dementia, which began to increase recently and has resulted in her being transferred to a nursing home. So I've added this to this, and this is the result. Has resulted in. Tells me it's the result of this information here. So that's an example of how you could combine sentences. But as I said, it needs practice. Okay, that's the end of the lesson. Please visit our YouTube channel for more videos, www.oetmedical.co.uk. Website, you're already on the YouTube channel. So please like and comment, hit the share button, etc., so we can make more quality videos and more videos that you request. If you request certain videos, we'll try to do them. We usually can do them, but again, if we have a lot of requests, they may take more time, but we can usually do most videos. You can also book classes with us by going to the website or going to booking.oetmedical.co.uk. Our rates are very good. There are 2 teachers. There's myself, based in Asia, and my colleague who's based in the UK. So we're always willing and available to assist you and to improve you. So that's the end of this video. Please, as I said, click on the notification button, and every time a new video comes out, you will be notified. So see you in the next video. Thank you.